historic week because we will see presentations of the congressional budgets, and I believe we'll see some sharp contrast. Congressman Paul Ryan from nearby Wisconsin, my home state of Illinois, is going to prepare and present to the Republicans in the House of Representatives a budget which he says will bring our overall federal budget into balance over 10 years. It's a daunting task, and I commend him for his effort. But I also have to say that we've been there before. We've heard this budget before. We know what it contains. There are several elements in the Ryan budget, as he's announced, or at least some have announced in advance, which repeat the mistakes of his earlier budgets, and some of them are grievous. We understand that we need entitlement reform to make sure that important programs like Social Security, Medicare, and Medicaid continue for years to come. And we understand that there'll be some hard choices associated with those efforts to make these programs more solvent. But the Ryan approach continues to be something called premium support, and what it boils down to is this. In the out years, Congressman Ryan and the House Republicans want to offer to seniors across America less money to pay for their Medicare insurance. They want to privatize the Medicare insurance system. We are dedicated on our side of the aisle, both in the House and the Senate, to some basic principles. One of the first is to make sure that men and women across America from working families have a fighting chance, to make sure the tax code is responsive to their needs, to make sure that the programs they count on will be there when they need them. Most American workers in states like Massachusetts and Illinois, every hour of every day pay into our Social Security and Medicare system with the belief that when the time comes for retirement, Social Security and Medicare will be there. Unfortunately, what Congressman Ryan is proposing is to really break that promise. To say to seniors across America, you can pay in for a lifetime, but when the time comes and you really need Medicare, when you really need health insurance and you're retired, you may not be able to afford it. You can't come up with enough money to pay the premiums. What good is a Medicare system you paid into for a lifetime if it can't provide you the basic protection you need in retirement? Oh, you can balance the books, but at the cost of coverage, at the cost of the Medicare promise that's been made for generations. Therein lies the real crux of the difference between Democrats and Republicans when we look at these entitlement programs. We know reform is necessary, but reform should be based on best medical practices, on reducing the obvious waste in the Medicaid program, and not on penalizing seniors on fixed income who can't afford increasingly high Medicare premiums. That's the Paul Ryan approach, privatizing Medicare. It's not a good approach for America. That's a real difference.